So we'll get started on talking about Medicare by looking at your current Medicare card. This would be the red, white, and blue card that you receive as soon as you get Medicare started. And on that card, you'll see them mention something called Part A and Part B of Medicare. Now, Part A on your Medicare card says hospital. I think an easier way to look at this would be services that you go to medically overnight. So in many cases, this is going to be the hospital, but could be a skilled nursing facility. On the Part B, it says medical on your card. I like to think of this stuff as any sort of same-day services you receive. This would be like a doctor visit or a lab or an x-ray, something like that. And the combination of these two things is called original Medicare. When you have an overnight service or a same-day service, based on the type of service, they will send that bill to either Part A or Part B of Medicare. And Medicare will take part of what's their responsibility, leaving the rest to you. And we'll go over that in just a minute. First thing to know about Medicare is just like any other insurance plan, there are some similarities between this and other insurance plans. The first thing being a monthly premium. So if you are like about 99% of people in the United States and you've worked at least 10 years in your life and paid Medicare taxes, the premium for Part A is actually taken care of for you. So you would not be spending any money per month on a Part A premium. However, for Part B, if you're going to have Part B, there is a premium, and for the vast majority of citizens in the United States, that is currently about $148.50. That is a per month premium, and that would either be taken out of a Social Security check if you're collecting Social Security, or if you're not quite collecting Social Security yet, that would be billed to you on a quarterly basis. So that sets up the very first cost when it comes to Medicare. So let's get into some other costs of Medicare while we go at it here. I'll just go to the side here. So other costs to look at when it comes to original Medicare are going to be with Part A and Part B. An additional cost when it comes to insurance plans, you may have heard of this, it's called a deductible. And just like a car insurance, if you have a $500 deductible and you find a way to wreck the car, you're going to pay that $500 and then the insurance company will come in and pay the rest of that. It works the very same way in Medicare. Part A, or your overnight services, your deductible is going to be about $1,400. That $1,400 essentially covers you for the first 60 days. So that means if you go into the hospital, whether it's once or twice within, or 3 times within the 60-day period, your amount is going to be this $1,400 deductible right there. If you go into the hospital and it starts a 60-day period and you leave that 60-day period and say 7 months later you go back into the hospital, guess what? You'll have to start another $1,400 deductible. But if for some reason you are in for longer than 60 days on a continuous stretch, meaning you are in between 61 and 90 days, this is where Medicare says that they've spent a good amount of money towards your health care, and it's time for you to kind of kick in a little bit more. And just using some round numbers, you're actually looking at about $400 per day for every day after that 61st day. It continues to go from there if you're in the hospital overnight for between 91 and 150 days. That cost to you goes up to about $600 a day. And if some reason you find yourself in the hospital longer than 150 days or more, that is considered uncovered, meaning that any and all costs associated with the hospital at that point are going to be on you. Medicare is done paying entirely. So that's kind of what happens when it comes to your healthcare when you're looking at it on an overnight basis. If we're looking at Part B, remember these are same-day services like your doctor visits. There is also a deductible. It's not quite as crazy as the Part A. That deductible here in 2021 is about $203 per year, meaning that the first $203 that you spend towards a doctor visit or a lab or an x-ray or anything like that after the 1st of January, the very first time that you start using your Part B, could be actually any time during the year, just as long as you first started using your Part B, that $203 a year deductible will apply. After you meet that deductible, however, you go to what most people understand in Medicare as the 80-20 split. This is where you would spend 20% of all bills associated with any same-day services on Medicare. Now, most people are going to want to figure out what to do about all of these different costs right here. And that's why we have a number of different options when it comes to dealing with those costs so that you're not hit with unexpected or large bills when it comes to your healthcare from Medicare. So let me get started on the first way of handling that. Essentially, like I said, there's two different ways. This first pathway here is something I like to call the prepay way. And what this means is that you are going out and you are purchasing a policy from a private company. That could be anyone like your Florida Blue, Aetna, Humana, United Healthcare. And what you're doing is you're getting something called a Medicare supplement. Medicare supplement is also called a Medigap plan. This Medicare supplement plan comes in a number of different names, and they're all named, just to be more confusing, by different letters. So things like A, G, F, K, L, M, N. In fact, there's 10 of these plans that are going to be available. The interesting part is that any one of these plans, regardless of who sells that plan, guarantees the exact same benefits. So that means if you get a plan M from United Healthcare or you get a plan M from Humana, they both do exactly the same thing. The only difference is going to be in how much you pay on a monthly basis. Remember, I call this the prepay method of doing so. So essentially, you are buying a policy, which you're paying for every single month. On average here in Florida, you're looking at right around $200 a month if you are getting your supplement when you turn 65. And by doing that, essentially having that policy that pays for everything here that you see here, all of these different costs as you go along. So that is essentially a way of taking care of the additional costs of Medicare. You're just prepaying about $200 a month, or maybe more depending on your age, in order to offset the cost that Medicare would normally charge you. After that, the only thing to look at beyond that is going to be your need for prescription drugs. And this is done in what is called a Part D plan. Part D covers your prescriptions. Part D plans are also sold by all of the major insurance companies out there for a certain amount per month. And what this Part D plan does is give you significant cost savings on the retail cost of whatever medications you're on. I've seen medication Part D plans range anywhere from about $7 a month all the way up to about $85 a month. And with this plan, you have that per month. You're going to be looking at paying various copays for your medications throughout the year. So let's look at this total method. If you were to total up the amount of money you're spending on a monthly basis between the regular Medicare, your supplement plan over here, and say an average of maybe $25 a month for your drug plan, that comes out to just over $3,000 a year. Now, for some people, that's not a problem at all. For others, they think, I don't even use this much healthcare in a given year. So for people like that, there is a second option, and let's get into that now. The second option is an option I like to call pay as you go. And what that option is actually called the Medicare Advantage Plan, also called Part C of Medicare. Now, what makes Medicare Advantage plans a little bit unique is that they are also done by private insurance companies. So think your United Healthcares, your Humanas, Florida Blues, Aetna's, all sorts of different companies out there will do a Medicare Advantage plan. And essentially what that means is that they are an insurance company that says, we're going to come in and we are going to create our own plan with our own terms that does everything Part A will do, everything Part B will do, and oftentimes include a drug plan all within the same plan. And here's the monthly premium for that. Typically, it's about a $0 premium. You still have to pay your $148.50 a month to have Medicare Part B, but if you were to add on a Medicare Advantage plan in order to take care of all the different costs of Medicare, you're going to be looking, for the most part, at a $0 per month. So if you're thinking, how in the world do the insurance companies get their money? That's a great question. Medicare Advantage plans are put together in two different flavors, and if you've ever had work coverage or coverage through an employer of some kind, you've probably seen these terms: an HMO and a PPO. Now, whereas over here on the Medicare supplement plan, you're typically paying something, prepaying every single month. Remember, over on the right side, we're going pay as you go. So how that's set up is every time you go to see a doctor in either the HMO or the PPO, you are going to be paying copays. And the only main difference between the HMO and the PPO is when it comes to a plan's network. Each plan has a network of doctors. And in an HMO, your network of doctors is headed up by your primary care physician. Your primary care physician will send you to specialists if you need. They'll send you out for labs if you need. They'll send you for x-rays and so on and so forth. They will do that by giving you what's called a referral. So essentially everything goes through this primary care physician, sort of your quarterback of health. If for some reason you're looking for a little bit more flexibility, then you may look over here at a PPO. A PPO also has a network, but at the same time gives you the ability to go out of network to see doctors that are not included in the network. There are also no referrals necessary in a PPO. So what I like to look at is when you start comparing the costs of these copays here on both sides, you'll usually find that the HMO has the lowest cost possible, but usually the highest restriction. The PPO has a little bit of a higher cost, but a little bit less restriction. And if you compared it over here to the Medicare supplement, Medicare supplements have zero restrictions whatsoever in that you can see any doctor out there that you wish, but it's usually going to be at the highest cost. So somehow, between all of these different options, we look to find what's going to be the best scenario for yourself and for your family, based on your budget, based on the types of doctors you go to, and based on your medications. But that, in a nutshell, is how Medicare works, and I'm happy to help from here.